Hi, good evening. My name is Dan Gittings, and today I'm going to be presenting about lumps and bumps of the hand and wrist. So I'm one of the orthopedic hand surgeons or specialists at the Hoag Orthopaedic Institute. And first I wanted to talk a bit about what an orthopedic hand surgeon or orthopedic hand specialist covers. First of all, we cover many different tissue types in the body, and specifically we have a mastery of these different tissues in the upper extremity or in the arms. So the first tissue type that I'm going to describe today is bones. So they're the foundation for everything that we do and move in our daily lives, that have the structure for everything else that we build upon. The next tissue type I'm going to talk about are ligaments. So ligaments are structures or bands of tissue that connect two different bones together to stabilize the bones for the stable moving platforms that we use them for. The next tissue type is a tendon. And tendons are bands of rope that connect muscles over to the bones so that we can move bones and move in everyday life. Nerves are electrical cables essentially in the body that give us sensation and also power all the muscles in our body and tell them to move so that we can move from the signals from our brain. Blood vessels are also things that we specialize in. So these are the small, tiny passages in our bodies that provide the nutrients and the healing factors that we need to recover from injuries. And then lastly, there's skin, which is the covering for the rest of our body, our first line of defense against outside invaders or infection. So I think the first thing I want to kind of clear the air a bit is that the majority of masses in the hand are actually not cancer. Most of them, the vast majority, are benign. And if you have a lump or a bump in your hand or wrist, if you get on Dr. Google, you may find answers that are concerning. But I do think that you should take a step back and that the odds are this is unlikely to be something that's a scary problem and more likely to be one of the common problems that I see every day. So back to lumps and the different tissue types that I mentioned before, I think it's important to understand that hand specialists are well equipped to care for these problems because we have a good foundational understanding and ability to treat these problems. And these problems can arise from all of these different tissue types as I go through the rest of this presentation. So first I'm going to talk about some lumps or bumps that can occur from bones. The most common lump or bump I see from bones is actually arthritis. So as you can see in this diagram here, you can see some fingers, and the tips of the fingers have some lumps or bumps or swelling in them. So this is an x-ray of a finger. When you look at this part of the x-ray here, highlighted in green, you can see there are two white bones and a black space in between these bones. And this black space isn't just an empty void, it's actually a space that's filled with something called cartilage. Cartilage is a smooth gliding surface that allows our bones to move. In comparison, look at the tip of this finger. There's not that same kind of black space in between the bones. The bone has some sharp, jagged edges, and you can actually see some of the spurring of the bones and that some of the areas in this area actually look crooked. And this crookedness from the cartilage wearing out between the bones can lead to some common lumps or bumps in the hand, specifically in the tips of the finger, at the base of the thumb, and other parts as well. In terms of treating arthritis, arthritis can be accompanied by pain in addition to the lumps or bumps and deformities that they cause. Going from the least invasive to the more invasive types of treatment modalities we have for arthritis, the first that we have is a more simple approach, which includes splinting. If there's an area that is painful or tender, wearing a splint to immobilize the joints that are involved with the arthritis can be a good way to help treat pain and help with inflammation to try and get some of the swelling down. Another modality is anti-inflammatory medications, also known as NSAIDs or non-steroidal anti-inflammatory drugs. So some of these medications can be taken orally by mouth or in the hand because the skin of the hand is so thin. It's a good area of the body where we can rub creams on the hand because the skin is thin and it can absorb readily into the surrounding tissues to help with pain and inflammation. The next way that we can treat arthritic pain that can lead to a lump or a bump is a cortisone injection. Cortisone is a steroid which can help cool inflammation, and this can be directly deposited into areas that have pain to try and decrease the inflammation and decrease the symptoms. And for a last resort, for some of these lumps and bumps that are painful in the hand and the wrist, we have surgery. So when all other measures have failed, we can treat these problems by excising certain masses or treating painful joints by stabilizing the joint with either implants or some sort of fusion surgery to try and help with pain. Moving on from bones, we have that next tissue type that we talked about before, ligaments. So again, ligaments are the coverings that cover and connect two separate bones. One type of ligament lump or bump that occurs is called a ganglion cyst. A ganglion cyst makes up about 90% of the masses that I see in the hand, and it's the most common mass that you can see here. In the image on the right, you can see that there is a mass on the back of the wrist. It's mobile, meaning if you grab it, you can feel it kind of move around or shift. And if you take a flashlight, or in this case an otoscope, and shine it into the lump, it will glow, which means it transilluminates, which is another sign that that lump or bump is filled with a fluid. And so what a ganglion cyst actually is, if you look here on the diagram on the right, there is these two different bones called the scaphoid and the lunate. And in this diagram, between those two bones, there's the normal joint space covered by the ligament or the capsule around the joint. And what can happen is through microtrauma, so small injuries, or just from being a loose jointed person, that fluid can leak out of the joint and form a sac. And that sac has a one-way valve where it won't allow fluid to get back into the joint. And this passage of fluid that keeps leaking out but not back in can cause these ganglion cysts to form. The most common location for a ganglion cyst is on the back of the wrist. And this is involved with the scapholunate ligament, or the SL ligament, 60 to 70% of the time. So definitely one of the most common places I look for this problem. The second most common is on the palm side of the wrist. This involves what we call the STT joint, which is right next to an artery or one of the blood vessels in the wrist. And then lastly, these lumps or bumps can show up on all parts of the hand, including the tips of the fingers, backs of the finger, all the other areas of the wrist, or deep in the skin where we can't feel it. And these ones that are deep where we can't feel them as well, but we see them show up on some of our imaging studies, such as an MRI, they can cause pain. They're tender. Sometimes we can't feel them, but they show up on these other studies, and we know that they're there, filled full of fluid. A little bit of historical context on ganglion cysts. We used to call them Bible bumps, and the reason for this is because they're a fluid-filled sac, and it feels like something that you just want to pop. And so back in the day, the Bible was the largest book in the house and the heaviest, and people would take this book and hit the bump and try to pop it. But today, in this day and age, we have some more modern technology than large books. In this case, we have many different modalities, such as splinting. So if you splint these types of cysts or observe them over time, about 50% of them go away, but 50% of them do stay present or sometimes recur or come back with this treatment. The other option is to aspirate them, which is taking a fine needle and poking or trying to pop the cyst and draw some of the fluid out of it. And when you draw fluid out, it looks like a white jelly. And this treatment also resolves the problem about 50% of the time. But again, 50% of these can come back. As a last resort, we can also treat this condition with surgery. The reason that surgery seems to be more effective is, as I described before, ganglion cysts have a stalk with a valve inside of them. By doing surgery, not only does the surgeon remove the mass, but it also addresses the one-way valve to prevent the problem from recurring again. So with surgery, 95% of these masses can resolve with only a 5% recurrence rate. Moving on to the next tissue type, we have tendons. So tendons, again, are the ropes in the hands and the rest of the body that pull our muscles and connect the muscles to move bones so we can move in everyday life. In this example here, the second most common mass in the hand is something called a giant cell tumor of the tendon sheath. It sounds quite scary, but it's actually just a firm nodule. It's very slow growing. And here's an image of some pathology from a giant cell tumor that was removed. And you can see here that it has these large circular cells with small purple circles inside it. That's a giant cell there, highlighted in the yellow arrow here. And so the treatment for these giant cell tumors, when we remove them and send them to the lab, is to just remove that mass without trying to sacrifice the nearby structures next to the mass. The biggest difference between a giant cell tumor of the tendon sheath versus like a ganglion cyst is that when I see these and I remove them in the operating room, they have a much higher risk of coming back than a ganglion cyst does. And this number has been reported as high as 44% in some cases. So there's a good chance that even though the mass is removed, it could come back again someday, in which case it becomes symptomatic or bothersome, we just re-remove it. But again, this is a benign type of mass. It's not something that's going to spread to other parts of the body. The next tissue type that we're going to talk about, again, is nerves. So as a reminder, nerves are the electrical cables in the body that give our muscles the signals to move or tell us that we're touching something or have sensation. So these electrical cables are made of Schwann cells and also other tissue types that include the coverings of the nerve. So a Schwann cell is one of the cells inside of the nerves that's responsible for regeneration. Schwannomas is the most common type of nerve tumor, and these can be incredibly uncomfortable. You can feel a mass, you can feel burning sensations, and radiating pain. And oftentimes they're best diagnosed with advanced imaging studies such as an MRI. And you can see on the right, highlighted by the red arrow, there is a circle with a white circular ring around it. Kind of looks like a target. And so on MRI, we call this target lesion a diagnostic sign for diagnosing a nerve tumor, such as a schwannoma. The treatment for a schwannoma is to treat it surgically. So under the operating room microscope, we can use 20x magnification and look even at the smallest nerves, about 1 millimeter in diameter, and open up the casing of a nerve and dissect and remove any of the abnormal tumor that's present. So this is called a marginal excision. Again, trying to preserve the rest of the nerve that's there. There is a 4% risk when you manipulate the nerves and you're removing and working under that small, fine area that there can be some injury to the nerve or neuritis to the nerve that can happen as well. The other type of nerve tumor is a neurofibroma, which includes involvement of the nerve fascicles. So the nerve fascicles are the individual wires within a cable of a nerve. And this one is important to differentiate from a schwannoma because the schwannoma does not involve the nerve fascicles, and we can remove it and try and tease away the small cables. But a neurofibroma is involving the fascicle itself. It's slow growing, and the difficulty is that we have to go and resect a piece of the nerve in itself, the small cables. And again, we can do this under the microscope, but when we resect some of the cables of the nerve, that can lead to functional deficits such as decreases in sensation, or if it's a cable for motor function, for movement, it can lead to some weakness. So what we do is we'll take other pieces of nerve grafts to try and rebuild and reconnect the cables that we remove in surgery. Moving on, the next tissue type is blood vessels. So there are lumps and bumps that come from blood vessels as well. One such type is what we call a hemangioma. So this is an abnormal blood vessel growth, and it can feel kind of boggy feeling, and it changes with position as well. It can have like a purplish color, and when you have that mass that's dependent or gravity is pulling fluid down to it, you might see that it increases in size, but if you raise it up above your level of your heart, it pulls the fluid back out of the blood vessels and it can decrease in size. And on MRI, when we scan these masses, it looks like what we call a bag of worms. So you look inside, it just looks like, you can see on the image on the right, that white there, it looks like there's a bunch of worms that are all together in one big sack. So this is a clinical image of what a hemangioma looks like, and the treatment that I often do for this is an excision, so identifying the mass and removing it. There are other treatment modalities out there, including cryosurgery, trying to freeze the mass, laser therapy, and embolization for some of these masses, where a radiologist will try and stop the blood vessels feeding the mass to try and shrink it. Moving on, we'll go into the casings of the rest of the body, the skin. So there are different masses that can happen from the skin as well. In this case, we talk about an epidermal inclusion cyst. So what that is oftentimes it's a firm nodule. There might be some history of a remote trauma, even like a paper cut, where the skin abnormally grows and it envelops on itself and curls in and grows into the inside. So that's what it is. Skin is a keratinized tissue. And when we remove them, they actually have a very cheesy looking appearance. So we remove just that small piece of mass whenever we see them or feel them. And oftentimes on the pathology, we'll see skin cells, which is confirming the diagnosis when we send it to the lab. The other type of tissue, I know we talked about skin, but underneath the skin there is normal layers of fat that we all have. And a very common benign mass that we'll see, not just in the upper extremities, but all over the body, is called a lipoma. A lipoma is a mass that's made of fat cells. It's soft, it's rubbery, typically painless, and not typically very fast growing. It's usually just kind of there and staying about the same. And one way that we can diagnose it is with an MRI. An MRI can show that it's always the same color as normal fat on all of the different images, which is suggestive, again, of a benign fat tumor. If it's bothersome and it's a part of the body that's either cosmetically irritating or functionally debilitating to prevent us from doing activities, again, this type of mass is something that we can surgically remove, so trading a bump for a scar. So that concludes my whirlwind tour of all the different lumps or bumps of the hand and wrist. This presentation again covered all of the benign masses that we see, which is the most common type of problem that we have rather than any kind of cancerous ones. Those are quite uncommon and much more rare, but certainly I would consult with your local hand surgeon or hand specialist before making a definitive diagnosis. Again, my name is Dan Gittings. My office number is below at 714-937-2168 if you have any questions, or you can visit my website at ocorthohand.com. I'm happy to welcome any questions or comments that you guys have. All right. So my offices here, you can see, are in Irvine at the Hoag Orthopedic Institute at the Physician's Office building. And my other office is in Orange, right on Main Street, attached to the Main Street Hoag Surgical Center. Just giving another minute for any other additional questions or comments to come in. All right, so looks like we have a question here. Thank you. So this is a great question. The question says, at what point should I consider speaking with a hand surgeon or a hand specialist? Even though the vast majority of lumps or bumps are benign or non-cancerous, certainly I'd say if there's a mass that you notice that it's growing in size, that can be a warning sign to see someone sooner than later, or the mass becomes painful. That can be something that can be debilitating and a good reason to be evaluated as well. So it's a little bit of a moving target. I think painful and slow growing and growing masses are definitely good reasons. Or certainly if you're looking for reassurance that this is not a problem that is of concern, I'm sure that your local specialist would be happy to take care of you. Thank you. So the question is, I have Dupuytren's contracture on both hands. It runs in our family. It started last year. And what's the best type of doctor to treat this? Just for the rest of the audience, a Dupuytren's contracture is a condition where there is abnormal scar tissue that forms in the hand that can lead to a painless contracture of the fingers that can develop over the course of years. Often it's a condition that it's associated with genetics and runs in the family, and can cause this problem as we age. The best doctor to try and treat this condition of the hand is actually an orthopedic hand surgeon or a plastic surgery or general surgery trained hand surgeon, as there are different modalities that we can use to try and treat the problem. Some of them include a meat tenderizing injection, essentially called Xiaflex, where we inject medication into that palpable cord to try and treat the contracture. Some doctors will numb up that area and try and poke the cord with a needle to try and release it, to try and help straighten the finger. And then the other resort is doing a surgery to try and remove a portion or the entirety of the cord in a Dupuytren's contracture to try and help straighten the finger out to improve function. Thank you. So the next question that came in, are hand surgeries done in the outpatient setting or during an office appointment? The answer to that is actually both. Certain hand surgeries can be done in our outpatient surgical centers. And even in those centers, I know that hand surgeons will do procedures both under local anesthetic while a patient is awake and able to converse during the procedure and not be sedated, so they can drive themselves into the procedure and then drive themselves home immediately after the procedure. The alternative is that they can be sedated in the surgical centers or get general anesthesia as well for more involved procedures that might be more uncomfortable. So to answer the question, a lot of hand surgeries can also be done in the office, specifically the ones that we can do under local anesthetic. So I'll commonly do some procedures in the office that involve just local anesthetic, where I'm treating small infections in the hand or the wrist or even in the fingers to try and eliminate an infection or remove small masses or other problems that are present. Thank you. So the next question is, I have a small lump on my left upper hand on my wrist. Shall I just observe? I think it's difficult to kind of answer that question without seeing a picture or getting a little more information. But certainly you're welcome to call my office if you're in the area to make an appointment. I'm happy to see you. But otherwise, majority of these masses oftentimes are benign, but certainly if it has some of the signs of something more concerning, it's a red flag, such as there's increasing pain or increasing size of the mass. Those are good reasons to get seen sooner than later. The next question here is, I have noticed on my parents that their middle or index finger seem to get stuck when opening from a fist. Could this be a sign of Parkinson's? This kind of catching or getting stuck of fingers when opening from a fist, this is a common thing that we see in the hand surgery office, oftentimes called trigger finger. So trigger finger is, when we go back to the tissue types I was talking about before, which is tendons. Tendons typically glide through a pulley, and sometimes when these tendons swell, they get stuck in the pulley and they don't glide as well, which can lead to that catching, clicking, or locking of the finger when they're bent. So some of the treatment options that we treat trigger finger with include splinting, cortisone injections, and a small open release surgery, which can get back to the last question, can be done under local anesthetic in both the outpatient setting or sometimes in the office to treat this problem. So it seems like that's all the questions we have for this evening. I appreciate everyone's attention and hope you all the best.